Right, Ilse. So today, the first session, of course, anyway, you have a fair amount of idea over the healthcare topics as we discussed in the morning.
Mm-hmm.
So let me explain you what are the responsibilities being a business analyst we do when we are comparing from the regular business analyst to healthcare first, because that is the first of all the fundamental difference for any business analyst who is transforming towards the domain side, either it could be healthcare or something, they should know about the difference first, right? So how and what responsibilities being a BA we have to render. If you are working for healthcare, or you may be working for banking, you may be working for insurance, retail, etc. Okay.
Mm-hmm.
So these are the responsibilities of a business analyst. Let me start with it. Okay. So that if you have any confusion over here, so that it will be wiped out. So whatever the responsibilities I have mentioned you so far, you can see here, all these are the common responsibilities. You can see all these. Whatever I have mentioned here, all these were the common responsibilities because identifying the objectives, collecting the requirements from the customer, and translating business requirements from the to the technical requirements. All these things are something business analysts do for any organization. So this is nothing to do with technology, and this is nothing to do with domain. So not
Yeah.
only translating requirements, but when you translate the requirements, there must be some visualization is required. So it is not something alone that we prepare documentation, but of course some kind of visualization of requirements will also be essential. On that grounds, normally Balsamiq, right? So Balsamiq we use for wireframes and mockups and all that. At the same time, we use Microsoft Visio, Star UML, Rational Rows, and all everything to prepare UML diagrams. You know that, right? Because we prepare
Mm-hmm.
use case sequences and all that.
So I
So
know
this
how to
is,
do that. I know BPMN as well.
yeah, business process management. Which tool you have used? Appian
It's
or
true that I
Appian
used
or Pega?
yeah, BPMN 2.0.
Pega, na? Pega, which PPM tool you have used? Appian? Pega or Appian?
What?
Business process management tool, I'm asking BPM tool. Is it Pega or Appian you have worked with?
No. It's
Okay,
B
basic BPM diagram tool. Ah, okay,
yeah,
okay.
basic BPMN diagrams. As
Okay.
in
I
draw.io.
thought of BPM means Oracle we have. Sorry, Pega we have. Pega BPM and Appian BPM we have. The reason I'm asking.
Oh, okay. I've never heard of those.
Yeah, because because I was familiar with Appian earlier. The reason I'm asking. Okay.
Oh,
Anyway, you know how to prepare business process diagrams, all that, right? So this is all something. Being a BA, irrespective of technology and the domain, you must be good and familiar with, right? These are all the points.
mm-hmm.
Now, importantly, if you see the major difference, if you are being a business analyst working for healthcare organizations, the very first thing is that we need to know about having a knowledge over the insurance plans, the very first thing, as well as the kind of services which exactly it will be providing. So when we talk about insurance plans, of course, in the morning we have discussed the same thing. We have different insurances we have, something like Medicare and Medicaid, wherein of course in Medicare we have different sections A, B, C, D. In Medicare, we don't have any sections as such. But it's not only that. One should have an idea over the private insurance plans, which organizations, private insurance players will participate in. Because if you know, if you remember when we talk about Medicare C, Part C, right? When you see C, because A, B are different. A is for inpatient services we use, whereas B will be used for outpatient services. But whereas C is the one which is normally we call it as Medicare Advantage Plan, isn't it? Right? It's a Medicare Advantage Plan. So this Medicare Advantage Plan will be used by the private insurance companies. Normally, government has given this Plan C, right? What are the Plan C under Medicare will be given as a Medicare Advantage Plan by the private insurance companies. So if we are a business analyst working for healthcare, you may be working for two different companies. One, you may be working for provider. Second, you may be working for a payer. Understood?
Okay.
Understood? Following on, right? So either you may be working for a provider or you may be working for a payer. Who is provider? Who is provider? Who is provider?
You want me to answer that?
Yeah, I'm asking you. Who is provider?
Oh, okay.
So
the provider is the
it could be who are providers.
whoever provides the services.
Provide services means healthcare organizations, right? Hospitals,
healthcare
clinics, right?
organization.
So nursing home, nursing clinics. All these people called as providers. Now, you may work for payers sometimes because the job opportunities for healthcare will be of two different companies. One is for provider side or payer side. Provider means healthcare organizations, as we discussed. Now, who are payers then? Who are payers?
The insurance companies.
Right. Is it only an insurance company? It can be CMS also.
Oh yeah, the
CMS also.
Medicaid and Medicare.
Yes, Center for Medicare and Medicaid Services, which is a government entity organization, where you mean CMS, insurance companies and all. So, if we, being a business analyst, whenever we are working on healthcare, being a BA, when we are talking about or when we are trying to understand about the insurance plans, this is not something confined only for Medicare and Medicaid, because most of the people have some misconception over that it is confined to Medicare and Medicaid, but absolutely it is not true. So it's not only for Medicare and Medicaid. Being a business analyst, you need to have a knowledge over the private insurance plans, which private insurance companies will provide. Because if you see private insurance companies, let me use Paint here. Okay, 1 minute. I am using Paint to write. Okay, right. So can you see the screen now? Right.
Yes, I can.
Yeah. See, this private insurances. Usually, of course, they have different things. In private insurances, we have two things. One is HMO and second is PPO. Okay, HMO and PPO. So what is HMO? HMO is nothing but health maintenance organization. Okay. Whereas PPO stands for Preferred Provider Organization. Did you understand this? Right. So two things.
Yes,
so one is when we see, to remember this, whatever I'm explaining you from the private insurance point of view. So whereas government level, you know, right? So we have Medicare, we have Medicaid, you know that. But when we talk about private insurances, there are two plans. One is HMO and second is PPO. So HMO will be usually this is a basic plan. This is a basic plan, right? So this is a basic plan where an individual, whoever is having an insurance of HMO, they are eligible to meet any doctors who are in the respective network. Because we have two networks, right? East and West network. Whichever the network RV belongs to, and whoever the doctors network, we call it as East and West network. Right?
Okay, East and West
networks. Okay. We call it as East network. We have list of doctors, list of hospitals, clinics, nursing homes, all that. At the same time, in West network also we have a list of hospitals which are comes under which are eligible for insurance, right? So all these details, nursing homes, everything will be mentioned in it, clinics, all that. So if an individual has taken an HMO plan in context to the private insurances, HMO is an health maintenance organization, which is a basic plan where an individual, whoever is using this plan, is eligible only to use or to meet only the doctor, whoever is nearby. Okay, that's it, right? So they don't have any authorization or they don't have any facility to meet any specialized doctor. For example, someone wants to meet any expert doctor for further maybe for further reasons or something of that sort. This basic plan doesn't provide. Point number one. So whereas preferred provider organization is something which is a premium plan. Understood? LZ, right? So premium plan. Premium plan means where it's a premium will be higher usually. So where an individual, whoever is having an insurance plan, are eligible to meet any specialized doctor if they require. Okay. So normally when we talk about private insurances, when we see two plans, one is HMO and second is PPO. HMO is a health maintenance organization, which is a basic plan, whereas PPO is a preferred provider organization, premium plan. Now, after that, there will be some customized plans also. For example, right? Customized plans. I'll give you an example for you, right? So for this customized plans, I'll give an example. Let's say, for example, there is a company called Y. Y is a company. For example, they were into software. Software company it is. It's a software organization, consulting organization company. They have, I'm giving a rough example, okay? To have a better understanding, I'm giving this example.
Yeah, that's fine.
Let's say, for example, they have somewhere around 5,000 employees. Now, in this 5,000 employees, a company, as per the company policy, rules and regulations, organization has to provide health insurance and health benefits to them. Do you agree? Yes or no?
Yes.
Right? So we have to provide health plans and all everything to them. That's what usually it was, right? So health insurance and all has to be provided by the employer to the employee. Now, what this organization do, Y company do? This Y company, yeah. So this Y company will contact these private insurance organizations. Understood? Clear?
Yeah.
Are you following? Right?
Mm-hmm.
This customized plans, for this customized plans, what this organization do? This organization will meet the private insurance company. Who will meet the private insurance companies? Y organization Y. Okay.
Mm-hmm.
Y company, right? Y software company. For example, if it's a software company, right? Why? What they will do? They will meet this private insurance company. For what purpose? Because they want some kind of customization plan required. What they want? Because they want some customized insurance plans, right? Health insurance plans for their employees. Understood? Healthy, right?
Yeah.
Following or not, right? So what this Y company do? Y company contact this private insurance company and they want some customized insurance plans. So what this company do? What this private insurance do? Private insurance will come up with some customized health plans. Customized health plans, right? Customized health plans exclusively for their customer. Who is their customer? Y software company.
The company.
Understood? Right? Understood or not? Right?
Yeah, I understand.
Right? So whatever this, do remember, whatever this customized healthcare plans is only specified only for the Y company only. This private insurance company don't give this customized plan to other people. Okay, because this is a customized plan they have designed only for the Y company only. Understood, right? This is what it was. So again, the kind of reimbursement, the kind of eligibility criteria, all these will be depending on the designation which that employee is holding. Because some employees may have what we called some employees may be in the director role, some employees may be in the vice president roles, Some employees may be in the mid-level and the senior level management, etc., etc., right? Senior and mid-level management. So depends on the kind of band. Usually in software, we call it as band. Band means whichever the band you belongs to. Band means designational hierarchy. So based on the designational hierarchy, whatever the benefits they will be getting from the software company will vary from one to another. It will not be the same. It is again depending on the designation they were holding. It is depends on the kind of salary they are getting, whatever the compensation salary they are getting, take home, right? So based on that, whatever the whatever the benefits and all everything, we have some slight variation. I don't say that there is a complete variation, but some variations will be there. Understood easily, right? So this is what it is. So
So I have a question.
go ahead, please.
So the private insurance for the let's use the Y software company. Can they, is it possible to get the private insurance for both? Depending on the band, can they decide to get the HMO and the PPO as well?
That is the discretion of the private insurance company, because how
Oh
they
yeah,
are how they
I'm
are
asking
customizing
if
the
they
plans
can.
will vary.
Oh, okay.
Because whatever the plans they were customizing and all everything, that will be varied. Because end of the day, what private insurance company want? Private insurance company want to retain their customer. Am I right?
Yeah.
Why? Because they get monthly, they get premiums, or yearly they get some premium amounts, all that, which is a big business, right? 5,000 employees is a big business. So they don't
Yeah.
want to lose it. So customized plans, whatever they are making, which is a combination of these two, which is a combination of
What I wanted to
HMO
ask.
and PPO. It can be HMO falls under, it can be PPO falls under that, right? So customization plans can be made. Do remember, this is exclusively for a customer they are giving. Okay. For example,
Gotcha.
you could ask me one thing. For example, Raj, if this is the case, for example, a person who is a self-employed, right? Or who is a business person, for example, right? Self-employed or a business person is not a employee for any other organization. They don't have any employment in any organization officially. They are doing some business, so small businesses or someone. But they should also take some insurance, right? They should require. Forget about Medicare, Medicaid. Anyway, that will be there, apart from that I'm talking about. So how about this private insurance? So what private insurance companies do? Whoever the individual people come for insurance, whatever the existing plans they have, those plans will be given to those people.
Oh, okay.
Understand, right?
Yeah,
Because this private insurance company will have different plans. They will have different health insurance plans, right? Right or not? They have different health insurance plans. These health insurance plans will be given to the individual people who applied for insurance. Understand, right?
Yeah, I understand.
Understood, clear, Elsie, right? This
Yeah,
is what
clear.
it is. So if you are a business analyst, it's not something completely about knowing about medicine. Why I'm saying all this, because it's not something completely being a business analyst we will be knowing about Medicare and Medicaid. Of course, there are a lot of opportunities, there are a lot of requirement in Medicare and Medicaid in market of US, in US market, which is a great. But it is not 100%. Sometimes we may have an idea over the private insurance plans which are already existed in the market, if any. Again, that is depending on the private insurance company, what it differs, right? Because insurance company A and insurance company B, what are the insurance plans they have and all everything might be different. Understood, right? So if you are a business analyst, now if we are business analyst, there are chances that we may get the job opportunity in the following areas. In the following areas. So what are those areas? The following areas as follows. What are those following areas? The following areas, nothing but, the following areas, nothing but provider, right? So who are providers, right? The first job opportunity we may get, there is a possibility provider means healthcare organizations, right? Hospitals, etc. Right? This is point number one. Point number two, we may get a job opportunities in the payer, means insurance companies.
Or CMS.
Or CMS. Oh, fine. Or CMS, Center for Medicare and Medicaid Services. This is point number two. Or we may get a job opportunities in IT companies also. Understood? Clear?
Yeah.
Got my point, is it? Right? So
Yes.
if you, but the kind of, why I'm saying all this, because if you are a BA, when you are working for any organization, the kind of roles and responsibilities what we need to render varies, depends on the kind of customer, kind of employer where you have joined. For example, you are working for a hospital, you are working for a healthcare organization or a hospital which is very big in US, for example. Okay, so whatever the job responsibilities you need to render being a business analyst will different. Why? Because if you take, for example, if you take healthcare organizations, they use different applications. Am I right? What these healthcare organizations do? Healthcare organizations use different applications. Different applications like Epic software. You might have heard about this, right? Epic software will be for taking patients
That's the
and all
first
that, right?
healthcare
So
tool
all
I've
that,
heard of.
right? So they may be using Facets application. Okay, Facets application will be for managing the core administration of healthcare, all that, right? Or they may be using some QNext, right? Multiple, I'm saying, right? QNext application, or else, tell me please.
Question, is Epic an ERP?
ERP is separate.
Okay, what does Epic do?
Epic is nothing but Epic is a software. Epic is a software which will be majorly used to manage. It's a hospital management system. Simple. Epic is a hospital management system. For example, if someone is running the hospital, there are different divisions. I will show you. Let me show you. I will show you directly.
So is it like the Salesforce of hospitals?
No, Salesforce applications are different.
Oh, okay.
Epic.
I'm just saying, is it like the way Salesforce is in different organizations?
So because Salesforce and all everything will be used for this one, will be used for the CRM application, Salesforce, Dynamics, etc. So this is what generally Epic was. This is an Epic is a software application. Software. I can say it's a software. So who uses this software? This software will be used by the organizations, hospitals. For what purpose? They want to update any health plans, or they want to see the patient flows, or they want to know about the analytics as well as the data of the patients, all that, or they want to access any kind of revenue or cycle and all. This Epic software they will be using. Understood? Clear? So in a simple note, I can say Epic is nothing but, I'll write down here. Okay. Epic is a hospital management system. On a simple note, I'm writing. Okay, I'm not using much good vocabulary, high vocabulary. Hospital management system. Understood? Right?
Understand.
Is it clear for you?
That's clear.
Right? Right. First point. Second, what facets in QNext and all, these are all used as a healthcare administration systems. Healthcare admin systems, everything, right? So right from claim management, claim adjudication, right? So everything we can be done, then core healthcare admin system, I can say. core healthcare admin system, this facets, or at the same time we have QNext, all that. At the same time, organizations may use some CRM applications also. Okay, CRM. For example, they may be using software, Salesforce.
Oh, okay.
Okay, or else they may be using some MS Dynamics, Microsoft Dynamics, etc. Right? So they may use CRM. Next, they may be using some ERP application also as separate. I'm saying, what is ERP of? They may be using, for example, SAP. Example I'm giving. Okay, it could be of any application in real environment, right? It difference from cost to cost and all everything. It will be varied. So these are the different applications. Yeah, these are the different applications. Yeah. So these.
I think I just lost your audio.
Yeah, 1 minute. Yeah. So
Oh, okay,
these,
okay. Sorry.
yeah, it's okay. I've just stopped my voice. I have not
Oh,
stopped.
okay.
Right. So these are the different applications. Whatever these are the different applications which organizations use. Healthcare organizations use to manage all that. So, for example, sometimes what they do, they want to integrate this Epic with CRM. For example, sometimes. Understood, right? So they want to integrate Epic with CRM, right? So that is one thing. It may happen sometimes. They want to integrate with Epic with CRM. Yeah. So they want to integrate Epic with CRM, right? So for example, Epic software is there. For what reason Epic is being used? Epic is a hospital management system they were using. So when they are using hospital management system itself as an Epic, when we see this Epic hospital management system, yeah. So this hospital management system, which is
Call
called
Owen.
Epic, can be incorporated with Salesforce or Dynamics sometimes. Sometimes they want to integrate with this Epic with Facets application. Or else, for example, hospital is using some other healthcare application long back, something like Fox Pro, Lotus Domino. For example, some application they
A
were
legacy
using.
tool?
Sorry?
I said something like a legacy solution.
Legacy. Yeah. I can say, for example, legacy applications like Fox Pro, Dominus Server, or something like that. They are Lotus Domino, something like that. Okay. Now, for example, organizations wants to transform themselves into facets or something. This is where generally facets integration come into picture. So if you are being a business analyst, when you are working for the provider, okay, when you are working for a provider, being a business analyst, it's not only about whatever the applications they were using, you have to make sure and you need to understand what are the different changes required. For example, organization to organization, this facets application may require some customization to be made. Understood? Clear? Are you following me? Right? For example, this facets application, what are the facets application are we talking about? This facets application might require some upgradation to be made. For example, some sort of changes to be made in the existing ones. So what organization, who do that? These things will be taken care of by the BA. Point number one. Point number two, for example, they are using some legacy systems way back in 60s, 70s, or 80s. They have used started using from there onwards. They are using some legacy systems. What they want to do now, they want to move into facets or something. This is where generally this data migration and as less facets integration is required. So for that, whatever the requirements and all everything will also be taken care of by the business analyst. Understood? Clear? Right. So knowing about rules and regulations, knowing about Medicare, knowing about Medicare, knowing about HIPAA rules and regulations, CDA transaction codes, CPT codes, ANSI form standards, all these are the one area. Okay. Apart from that, what else is required? Using all these information and all, what kind of activities do we require to perform within the organization being a business analyst is what we must be good and familiar with. So this is where generally this part come into picture. Understood?
Yeah, I think you need to change the color from color 1 up where the color palette is. Yeah, I think that's where that might be where the issue is.
Okay, is it fine now?
Yeah, I think it's fine.
So, for example, facets they are using, right? Facets they are using, facets provided, right? They may be using face killer. Next, for example, there must be some integration you may be required. Yeah, so you may be required some integration where you want to integrate with the Epic to CRM, for example, right? You want to use Epic and CRM to be integrated because in CRM, in Salesforce, we have a concept called Health Cloud, because Salesforce has an application called Health Cloud as separate CRM. So these are the things which being a business analyst, one has to understand. Understood, right? So if you are a BA, when you are working for a provider as a healthcare organization, you should have a knowledge over whatever the healthcare plans and all everything. This is required something, right? At the same time, if you require any kind of integrations, any changes, happens within the application, those requirements has to be addressed. Clear to you, LC? Right? Understood or not? Right?
Yeah, but if you're using Agile, if you're using Waterfall, how easy is it to change those requirements?
See, it is nothing to do with waterfall. It is nothing to do with agile. See, waterfall and agile for what purpose? This is to make application to complete as earliest, or if you want to make any kind of changes in the existing application every time. For that reason, you are going for agile. See, let me tell you one thing. For example, for what purpose are we going for agile nowadays? Because customer wants to make some changes in the existing application very fast. Customer is expecting us to deliver project in very less time. Customer wants to add some new requirements in regular intervals. So for that reason, we are going for agile. Am I right? Yes or no? Right? Otherwise, what is that we can do? We can use waterfall model and V model also. Am I right or not?
So what?
LC, right? For example, customer doesn't have any requirement that I want to complete in 2 months or 3 months. What we can do? We can use waterfall model. Am I right
Yes.
or not? Right? So whatever the requirements are